Hello, I did my presentation on HIV and AIDS. HIV is the human immunodeficiency virus that actually infects us, and AIDS is the acquired immunodeficiency syndrome if it gets left untreated. Um, HIV, a little bit about the virus. There's two different types of human immunodeficiency virus that can infect us and give us HIV. They're both retroviruses from the lentivirus family. In their conical capsid core, they have a single-stranded RNA. I think they have 2 strands per virus. And they also have 3 enzymes. And these enzymes help them replicate their DNA or their RNA within the infected cell. They are an enveloped, you can see here, an enveloped virus. So HIV is transmitted through bodily fluids, specifically blood, semen, rectal fluids, vaginal fluids, breast milk. So when the viral particles transfer from an infected person to a non-infected person, they enter the bloodstream. They can enter through open cuts, sores, through the mucous membranes in the rectum, vagina, mouth, or tip of the penis. Fun fact, a reason why kissing isn't transmittable even though it is a mucous membrane is because our saliva has some enzymes that actually are able to inactivate the virus. So they can also be transmitted through direct injections. So like Ryan White, he was infected with HIV by getting a blood transfusion with infected blood. So it could be done through medical procedures, although nowadays they are screened way better, or if you are an IV drug user. The virus does dry out when it's exposed to air, so you can't get it from toilet seats or things like that, or just sharing plates with people. So the HIV virus actually has some glycoproteins on the outside, and they have high affinity of connecting with the CD4 receptors on our cells, specifically our CD4 T cells, because they're very abundant on that cell as a little indicator. They also have the co-receptors CCR5 and CXCR4. Those actually come in handy because we have some mutations where we can inactivate these co-receptors and actually make it harder for HIV to infect our cells. So some people are actually resistant to HIV just naturally through a genetic mutation. Some prevention methods. Medication is actually right now the number one prevention method. So we have multiple different types of medication depending on what your situation is. So if you're currently HIV positive, you would be taking an HIV treatment medication, and this reduces the risk of transmission because it reduces the amount of virus in your blood. They also have the PrEP, which is pre-exposure prophylaxis. So it can be done through oral pill or an injection. And if it's taken correctly for however long it needs to, it has up to a 99% chance of reducing your risk of spreading that. So if you're in a couple with an HIV positive partner, they would be taking HIV medication. You would also be taking PrEP as well, just to mitigate all of those risks. And then they also have PEP, so post-exposure prophylaxis. This is when you might possibly get exposure maybe through an accidental needle stick in your job, or having unprotected sex. It is a 28-day regimen, so that one you do have to just stick to your guns on. The number one way of prevention through reducing sexual risk is abstinence, but also use condoms because they reduce the risk of all STDs. Um, Reducing your alcohol and drug use, because alcohol impairs your better judgment and allows you to make more risky decisions and have more risky behavior, as well as IV drug users should take precaution, use sterile needles, that sort of thing. So because HIV infects your immune system cells, basically you can get infected by any like opportunistic infection. So that is kind of the reason why HIV is so detrimental to us. A lot of people are asymptomatic, especially there is a latent period in HIV where a lot of people are asymptomatic. So if you don't catch the early symptoms, after a while you might not even know that you have an infection of HIV. Early symptoms are like the flu-like symptoms, so fever, rash, swollen lymph nodes, sore throat, things like that. And then there is a period of the infection in the early symptoms that's the acute retroviral syndrome. It usually resolves in most patients, so that's why it's kind of like the flu. People might think they have the flu, and then afterwards it's like a latent period of time. So the disease incubation period, from the time of infection to development of the antibodies that you can detect in a test, is usually from 1 to 3 months. I got differing information on that from between 1 week to 6 weeks, 1 to 3 months. So I guess just test however your doctor wants you to test. I think it's like every 72 days if you have a negative result after an exposure. So from the time of infection and then to this is the asymptomatic latent period. So this is when you would have your early symptoms because there is a lot of virus and you're just trying to build up your antibodies. But then, as you can see in the end, the viral load will take over if you don't get treatment. So without treatment, it does develop into AIDS, which is the acquired immunodeficiency syndrome. It is the most severe stage of the virus infection. It is basically diagnosed when you have a CD4 cell count that drops below 200 or a development of a specific indicator disease, like an opportunistic infection that only affects the HIV immunocompromised people because they have damaged immune systems. So the only way to know for sure if you have HIV is to get tested. Because there is that latent period of time, you would want to get tested every now and then, especially if you are engaging in any of the risky behaviors. So different testing ways, there are 3 different testing ways. You can get an antibody test done, which is the rapid test. It is the only self-approved test by the FDA. You could do an antigen antibody test, that's a blood draw, or a finger stick, or a nucleic acid test. This is the fastest way of knowing because it can be done within 10 to 33 days after infection because it just counts how much virus is in the blood. So different treatment options. So as said below or before, undetectable is untransmissible, and the viral load is the amount of HIV in the blood. So when there's an undetectable amount of HIV in the blood, it is untransmissible, and that's what we want. So it will not transmit to anybody else, and that is treatment as prevention. So the treatment method is antiretroviral therapy. It helps control viral load to be undetectable. It is taken for the rest of your life because if you get off of it, your viral load will skyrocket in most cases. So basically, it's a combination of different drug classes that attack the different enzymes to block different stages of the HIV replication process. Also, there is some medications that just block the HIV from entering the CD4 T cells. Also, there is treatment for just the infections that you get when your immune system is down as well. So doctors will want to treat those. So some interesting facts about HIV. Currently, there are 7 people cured completely from HIV, and that was done through a stem cell bone marrow transplant. And it was actually not to cure their HIV, it was actually a last resort to cure their blood cancer, and HIV just came as a result, or HIV cure just came as a result for these people. So a blood marrow transplant has to be very specific to the patient, and when you are trying to cure HIV, you also have to look for the people who have the genetic mutation of having the no CCR5 on their, so that was the co-receptor. So they have no CCR5 on their T cells. That means it's really hard for the HIV to infect their cells, so they're basically HIV resistant. So on top of finding somebody who's compatible for the donor, you also have to find somebody who has the genetic mutation of the CCR5 gene. And previously it was said to have to have 2 copies of the gene, but we have been doing it with only 1 copy of the gene. And there has been actually 1 person cured from a bone marrow transplant with no copies of the gene, and it just worked. That doesn't work for everybody, but it worked for that specific patient, so that's incredibly cool. Another thing that I found very interesting when researching HIV is one of the first drugs to be basically used to treat HIV was AZT. And the first clinical trial for AZT was a double-blind study, so everybody was getting placebo. Nobody knew who the placebo pills were going to, but after a certain amount of time, so many people died compared to the people who were not on the placebo pill, and so it was evident that AZT was working very well, actually. And so it was kind of cruel to let it go on, so they just canceled the placebo trial completely. So I found that very interesting. So that's what I learned about HIV, and I hope you guys enjoyed it. Thank you.